While we were visiting with the students at Southwest College of Naturopathic Medicine, we asked some of them why they decided to become a naturopathic doctor.
My mother was diagnosed with debilitating diabetes, and she was under allopathic care, and I just began to see the progression of the disease, and she began to have various BKAs, or below the knee amputations, sepsis. She had a decubitus ulcer, a bed sore that was 7 inches deep, and I just remember thinking that in the allopathic world, it just seems like she could have received just better treatment. So I began to look up naturopathy and alternative medicines, and that's what pretty much led me to SCNM. I just wanted to make a difference. I wanted to offer a different form of medicine as opposed to conventional medicine. First of all, conventional medicine places emphasis on treating the symptom, and naturopathic medicine, how that differs is that we actually treat the cause. We actually find out the cause of the symptom, and in treating the cause, in many instances, the symptoms will take care of themselves. Lots of times we've all been to physicians and we've gone in with various types of ailments and come out with prescriptions for various types of ailments, but naturopathic medicine goes just a little step further. We actually focus on treating the cause, and if we can get the total man healed from the inside out, I think that just makes for better medicine, and that's one of the things that drew me, because I want to do more than treat the symptom. You know, I really want to facilitate a healing from the inside out, where the body is placed in an optimal position to pretty much heal itself.
My story, like many of my classmates that I met, is I was sick when I was in my young 20s and spent several years going to allopathic providers looking for the answer, and never really found it, and then was introduced to a naturopathic physician where I was living in South Florida, and just had amazing success with her working with me. And through that, she taught me what naturopathic medicine was and showed me that, wow, I can have this career where I can actually do healthcare, but I can do things that resonated more with me and with my body at the time. And so that's how I ended up choosing a career as a naturopathic physician. Since graduating from Naturopathic Medical School in 2004, I practiced for a year and a half, all the while I was getting ready to, I was actually in the process of applying to allopathic medical school, and then in 2006 I started at OHSU School of Medicine in Portland, Oregon, and I'm now in my 3rd year of training there, in basically my first year of clinical training, so I spend most of my days and nights in the hospital working through my different clerkships. I hope to practice as a colorectal surgeon and then bring my training, specifically my training in nutrition, and then bring pre and post-operative support to my patients. You know, I'm still a student in allopathic medical school, but I will say that my naturopathic medical education informs my behavior on a daily basis with patients, because I was really trained to walk into the room and to see the whole patient, to consider not only what's going on physically, but what might be going on mentally, emotionally, spiritually. And that's something that's very intuitive to me at this point, because it was drilled into me literally from my first day of naturopathic medical school. And so I think I bring that to all of my patients. Secondly, I think though I'll have time constraints as a surgeon, we don't spend that much time in clinic, I am always interested in how did you get here and how can we make sure that you don't get here again. So I think a lot of times surgeons are amazing at solving the problem. They cut it out, and a lot of times people get better, and it's a miracle. But we don't always take the time to look at how did you get here. And so I hope that I will have the time to do that, and if I don't have the time to do that, that I'll be able to send my patients to all of my fabulous colleagues and figure out how can I not see this patient in the surgical setting again.